what I thought I would do today is give you an overview of the vision of the Research Centre, our purpose and rationale, how we theme the work that we do, the sort of conceptual underpinnings and the themes that we're working towards, and then give you some example research projects so you get a bit more of the sort of concrete flavour of the activity that's going on. And then talk a little bit about the structure, which really will, towards the end of my presentation, bring back that idea of an international collaboration and how we got there and how we intend to continue with that. Measuring impact is the way of the world. We have to know that what we're doing is worthwhile. I don't think anyone sets out to do research that has no impact, but it is important that we actually identify where our impacts are and how we might enhance them. Right, push the right button, that's the next question. Okay, so the purpose of CEDA. So we explicitly set out to build an international collaboration. So we were clear from the outset that we wanted to, Peter Wilson and I, so I do actually have to acknowledge Peter Wilson very firmly in this. We are co-directors of this, and we set out together to see if we could build something that was bigger than what we were doing here at ACU and here in Australia, by really capitalising on our current relationships and opportunities that we had to actually build a collaborative that would be focused on research that was to the benefit of children and families through research. So we really are keen that we're clear at the beginning that we can do more if we operate internationally. And so at the moment, in this moment in time in our history, it makes no sense to do anything else. Many of our problems are shared across the world, and many of the solutions can be found in another place. So our risk of reinventing the wheel is very high if we only operate within our own backyard. But of course there are things that are very pertinent to our own backyard that we also need to pay attention to. So how do we build an international collaborative that enables us to pay attention to the things that are really critical within our own spaces, but also learn, share and drive an agenda that actually can expedite knowledge, both in the knowledge growth and development, but also the engagement in terms of translation and implementation of what we have learned over time. So we would see that that purpose feeds into 4 particular areas in terms of research in Australia. So first of all, we think that our research agenda is well aligned with Australia's health-based research agenda, that we can contribute to meeting Australia's research priorities through our research agenda, and we look to that. So we look to what it is that Australia says this is important at this moment in time in history for us, and can we provide one of the little bricks in that wall, maybe even more than one brick. We are very much keen on developing a research centre that is seen and visible and enticing to other people to come and join. So we're an open door research centre. We are very welcoming of students, postgrads, postdocs and other researchers, because we want to know what other people know. We want to engage with how other people think so that we can do collaborative problem solving together. We also think that this will enable us to develop synergies across the research programs, that people come with their burning research questions that are critically important and are often driven from their own pedagogy or their own discipline-specific ways of thinking and discipline-specific understandings of problems. But actually there are many synergies, and we can share those and build those so that we actually have research that's relevant broadly for populations as opposed to very narrowly within specific diagnostic groups, for example. And that's not to say we don't do specific research that is focused on people from particular diagnostic groups, but we look to the questions and the methods that will help us generalise beyond a very specific focus. Part of building a really good research environment obviously is to foster other research and also to provide an environment in which people can learn to be researchers and to grow their own research skills and capacities. So that's our sort of overarching big picture theme. But when we come right down to it, this is the vision. So our vision is to enable children whose lives are complicated by impairment or chronic disease or medical conditions and their families to meet the challenges of healthy growth and development, and to provide opportunities that will ensure they reach their full potential across the whole lifespan. And for me, this is the crux of everything that we do. So we come back and we look, okay, where does it fit? Where does it fit in terms of enabling young people, and then young people as they grow into young adults and then through their adult lives? How do we do work that enables people to do all of the things that they need to, want to and have to? And the OTs in the audience will recognise that little phrase. That is OT through and through. So this is, in terms of my life's purpose, if you like, has always been about looking to, supporting people to be able to do the things that are important to be done, or the things that just have to be done in daily life. So in terms of CEDA itself, we have 4 overarching themes, and they're the 4 Ds. And you'll see a couple of them in the CEDA acronym, but there are 4 Ds. And these provide us with essential conceptual foci for our research. So the first theme is development, the second one is disability, the third is diversity, and then the fourth is duration across the lifespan. So those are the 4 things that we, again, look to. So what do we mean when we're talking about development? Well, in the first instance, we're talking about children with childhood onset conditions. That's the sort of group, if you like, or the population that we primarily put our work in, but not only, but primarily. And of course, when you think about development from a childhood perspective, you can have an age-based kind of idea of development, so what happens over ages and stages and through transitions. But we can also think about it from a role-based perspective as well. So what are the role changes over time that we would expect young people to progress through as they grow into self-determining, independent or interdependent adults within our community? So we would think about development from both an ages and stages and a role perspective. We're also interested from a developmental perspective to have a really firm understanding and to be able to contribute the knowledge base around mainstream development. So in the absence of an interruption to development, what do we know about the neurocognitive basis of movement and cognition? Because that actually plays such a huge role in the decisions that we might take in terms of providing interventions or in terms of mapping what is happening and changing over time for young people. We're interested in how that interaction occurs between all of the developmental processes, but particularly focused on motor processes and cognitive processes around child development and how they change and grow over time. And again, that will lead us right down into looking at activity within the brain, as that is obviously the place to start. And we know that we have so much more knowledge over the last several decades around neuroplasticity, the importance of early interventions, and how early those interventions need to be, how careful we need to be in terms of the risks and benefits that we might need to consider when we decide to intervene very early in childhood. So understanding mainstream development is a hand-in-hand requirement, I guess, for any work that's going to focus on development in the childhood. We also think about childhood, though, and development in relationship to the transactional processes that are obviously very important in child development. Children don't develop in isolation. Most children develop in a way that is entwined within their family systems and their community systems. And for those children where there is an additional challenge to growth and development that comes with a disability or comes with a chronic illness, that actually impacts on the family and parents, as you all know, as well as the child. And so in our research, we recognise very much that there are lifelong impacts on parents and families where there is a child, particularly with a severe or quite marked disability or impairment throughout life, that actually change the shape of family dynamics, change the shape of the family, and change the shape of the lives of the parents of those young people. And we are very focused in the research that we do on ensuring that we're not designing things, as best we can, that while may be effective for young people, are not causing problems for the rest of the family. And that's not so easy to do, and it's not always at the forefront of research design thinking. And I can talk a little bit more about some of the things we're doing in that as we go. But we are very interested in ensuring that we can improve the health and wellbeing outcomes of parents where there is a child with an impairment or a chronic health condition, and to be able to share our knowledge so that actually we can make changes, hopefully, in service system and delivery systems around children from the point of diagnosis forward. Disability. Disability is, one of the key elements or the key themes within the work that we do. And I find it such an interesting and important space to be situating any work, whether it be research or education or practice, is in this sort of space of what happens when there is an impairment or a health condition, and then that interaction between an individual in an environment that then subsequently means that there are things that are hard to do or impossible to do. And, you know, sustained conditions that children have throughout their lives that they grow with can constrain their wellbeing, can constrain their developmental trajectories. And we want that not to happen. We want to be able to influence that so that that isn't what occurs. Disability statistics in Australia are probably at your fingertips, but just in case you've forgotten, it's over 18% of the Australian population has at least one form or declares themselves as having some form of a disability. That's over 4 million people. And then on top of that, nearly another 3 million people identify that they provide care for somebody with a disability. So there are a significant proportion of the Australian population, given that there's only about 26 million of us, who are engaged in this experience of disability. So again, what we're interested in doing is thinking about designing and evaluating effective interventions that prevent secondary impairments associated with the primary condition. If you have a diagnosis, if you have a chronic health condition, actually, what are the secondary complications of that we can intervene with to prevent them occurring? That improve the activity performance of the individual so they actually have the best capacity to engage in the activities that are of importance to them, and then optimise their engagement and participation in those life spheres that are really important to all people. Ultimately, it's that package of focus that's going to enhance quality of life, ultimately, as opposed to one individual approach to things. Disability is a really important piece of what we're doing. I think in Australia it's been an amazing time for us with the implementation of the National Disability Insurance Scheme, but I still perceive that there's a bit of invisibility in the disability space, and in terms of shifting funding for research, for example. Sometimes I think that's just sour grapes because I didn't get the grant I wanted. But, you know, it is, I think, still a difficult space to sell in competition with other areas of health and health research particularly. So it is a really important piece. It's important that we're visible, important that we're actually clear about our potential impact, and that we can actually name what it is that we are doing and the potential impact of what we're doing. And we do that best in collaboration. So the next theme is diversity, and I think for me, is also very, very important. So this is really recognising that all people have diverse life courses. All people, regardless of whether or not in fact there is a childhood onset impairment or a health condition that might influence their developmental trajectories, will have a diverse life course. You can put the same individuals into the same intervention program and have different outcomes. You can provide a range of individuals different intervention programs, and they can end up in the same place as each other. We have this sort of multiple ways of having to think about what it is that's going to influence things for the better for people. That is a real challenge for a researcher who likes to narrow things down to, you know, if this, then that. It actually doesn't work like that in life, unfortunately. But it means we have to be smarter about our research designs. It means we have to be really explicit about how we're going about asking questions and answering questions in our research. For me, the really critical piece of this is that if we take a sort of a unilateral approach or a really narrow approach, then we constrain the opportunities. We have to take a diverse approach to this. We have to recognise that diversity of outcomes is what we're aiming for here, not the same outcome for everyone. And for me, that's actually about not discriminating about people and about their opportunities and outcomes. And duration across the lifespan. So again, whilst we have a primary focus on people who have a childhood onset disability, actually we're interested in the entire lifespan. So we are interested from very early days, in terms of the early years when, you know, people are just finding out that perhaps something has gone not how you would wish it would be, and then all the way through childhood, those really critical early years of primary school, and then into adolescence, where we have that sort of important focus around identity formation and finding out who you are, as well as maintaining healthy habits for the lifespan. And then into young adulthood, how do you transition out of paediatric services into the adult world? How do you actually transition out of education into the adult world? How do we actually make that a much more successful journey than it is currently in Australia? The young people who have a disability are well overrepresented in our unemployment statistics, and they are well overrepresented in that group of young people who are still living at home, who don't have an intimate relationship. So we have a responsibility and an obligation to really support that growth and development right through into those adult years. And then, of course, we have, as people age with their childhood onset impairment, those aspects of life. How do we maintain health throughout life and grow into what we would like to think is our nice, wise old years together, regardless of our starting point? So we are interested in all of those aspects of the lifespan, and we have different parts of our team working on different aspects there and linking with other researchers in other research groups so that we actually make sure we have expertise across those parts of the lifespan. So we do have a conceptual framework, and it is the ICF as our core common language within the research group. Now, can I just ask, I'm making an assumption, does everybody in the room know the ICF? Yeah, has anybody never heard of the ICF? International Classification of... So we've got no hands on never, so that's good. So I'm not going to go into this at all. The ICF has been, as a framework, a critically important tool within health science research because it has provided researchers with a common language and a way of thinking about what it is that they are focused on. From our perspective, we really want to know if we are designing research, whether our research interventions or our research outcomes, where they are targeted in the framework. So we're not so focused on the classification system itself, but we are very much using the framework as a language. We do use the classification in some of our research to help us unpack some of the activity that we're doing. But if you think about it as a language, we want to know, does this intervention target body structures and functions? Or are the outcomes of this intervention at the participation level or at a body structure and function level? So we have to make a decision about where the intervention is going to be targeted, as well as what are the outcomes. Sometimes you want the intervention and the outcomes to be very closely aligned. Sometimes you're not interested in that. Sometimes you want to see if you make an intervention at one level, does it have an outcome at another level? So the language of the ICF framework has been an important piece of glue, if you like, within our research centre, because it helps us to talk to each other about what we're doing and how we align what it is that we're doing. And it gives us some language around some of our overarching objectives. So when we think about the research projects that we are designing and talking to each other, we say, well, where is it? What is the objective? Where is the change that we think that we're interested in here? So are we wanting to promote function and prevent secondary impairment? And if we are, then we have research that's focused at the body structures and functions level. Or are we wanting to maximise capacity and performance in daily activities? So our research is focused at the activity level of the ICF. Or indeed, is it about optimising engagement in school and health services or community or work, in which case our research is targeting participation part of the ICF? Or indeed, are we focused on the environment, on reducing barriers and enhancing supports, or a combination, of course? So it just helps us with that, being clear about our overarching objectives and how we work together as a team. This slide is just a collection of methods, actually, this slide, and I'm not going to talk about them all. It's really just to give you the flavour that there are amongst the team a range of skills that are really important. So if we want to be able to assess what it is that we're doing, we have to have strong, valid, reliable measures. So sometimes that means we've got to go and build them because they don't exist. If we want to know about interventions, we've got to be able to design good quality intervention studies. So if we want to look at basic mechanisms, we have to be able to have those expertise. So we have, I guess, just highlighting that amongst the team, we have people with research experience and expertise in these different methods. So CEDA has actually organised its research program into 5 themes. So I've given you sort of an overarching framework and some vision and purpose, but actually how we've then organised our research is into these 5 themes or streams and research programs. So the first is understanding and optimising participation. Then we have one around multimodal therapies for children with motor impairments, and then looking at mechanisms of motor control, learning and cognition in developmental disorders. And we have sort of a theme around innovations for using new technologies in therapies and interventions, and then a parent and family factors in childhood onset disability. So what I'm going to do now is just give you a couple more words about each of those themes and one kind of example from each of those themes to give you a little bit more of a concrete flavour. So in the participation research theme, we actually have a range of different studies going on that have been going on for quite some time. And I kind of just standing here recalling Fiona going, well, we just launched in March, and you're all going, how have they done all of that since March? Of course, we've been doing research together for longer than that, and the official launch was in March. But I just wanted to point out that this work brings together the kind of core leadership group of CEDA and also our research postdocs and students. And we've been doing quite a bit of conceptual work around trying to contribute to the literature around understanding participation as a distinct construct from activity. And so that's quite important, because in the ICF, anyone who's got knowledge in that space will recognise that was not done well in the ICF. It was very difficult to distinguish activity from participation using the ICF. So of course there's work to be done in developing and validating measures. We've had a longitudinal study going on since 2006 with kids with CP. We've done some normative research and some intervention pilot research. So I just wanted to give you a little bit of a flavour here. So with our conceptual work, it's quite small and you don't really need to read that, but just to give you the sense that we've been doing a series of systematic reviews. So really wanting to take a very strong methodological approach to understanding what's in the literature in relation to participation as an outcome for children who have impairments and disability. And so we've done a sequence of systematic reviews that has then led to the writing of a conceptual paper that presents a family of participation-related constructs, which we are going to now use to try and design and drive our participation-based research. And so that the third paper there is the copy of the proof, so that will be out in the next online early in the next little while. And I'm not going to go into it in any great detail today, but just to tell you that the upshot of this series of systematic reviews is this new model, or a model, that is an extension of the ICF. So it really takes the participation and activity blocks, if you like, out of the ICF model and explodes them and says, OK, we need to look at those things in more detail to really understand this. And so just to give you a very quick walkthrough here, we would define participation as having two embedded core constructs. The first being attendance, so that is you have to be there to participate, you have to be able to turn up to a place, and the second being involvement, that once you're there, you need to be your extent of involvement actually is a reflection of your participation. So it's context-free in some ways, those two constructs, okay? So being able to turn up and being involved when you do turn up. If you can't turn up, you're not going to be involved. But when you can turn up and still not be involved, okay? So we need to understand both those pieces. Of course, we would also recognise that there are attributes of the person that are really important and that often get tangled up in the literature in relationship to participation as a construct. And the first of those is activity competence, so the skills and abilities that a person has. Are you independent is a really good example of tangling up participation and activity, okay? Because independence is about competence, really. Do you have the skill sets to do it, okay? It's not necessarily about attendance and involvement. All right, so really wanting to separate the constructs. The sense of self is also a really important aspect of participation. So that's things like your self-esteem, your self-determination, your sense of satisfaction or being proud about what you've done, your sense of engagement while you're actually doing something. So those senses of self are a really important group of constructs that relate to participation. And then your preferences. So actually, are you doing the things you want to do, or not doing the things you want to do, or indeed doing things you don't want to do? Now, obviously, when you're a child, you have fewer choices, so sometimes you have to do things you have to do, even as an adult, actually, sadly. So those are important constructs that have frequently been tangled up in the literature, so we're wanting to actually untangle them. And then the yellow person in this model really represents sort of the self-regulatory processes that bind those sort of personal things together and help. So this model, that's sort of the blocks, if you like, within the model. But actually, we're really interested in the transactions that occur because participation is a transactive process. And we think about it from two different perspectives. The first is participation always happens in the context of an environment, in a context in an environment. And the transaction between the person and participation in the environment is one where the environment might provide affordances or indeed regulate what you can do. But there is also an influence of the person on the environment. So the person interacts in the environment and they shift and change the environment. That's a transaction. Okay, so it's not, they're not a person in an environment isn't a non-active agent. They're there changing the environment. And we don't often attend to that piece in our research. And then the other piece that we're interested in are the transactions between those person-related factors. And again, this is a whole other separate kind of conversation perhaps, but really just wanting to put it on the table as one of the core pieces that we have of work that we have done as a senior group within the research centre to try and provide ourselves with a model for the future design of our research in this space and how it would be informed across other research programs. So the second theme is the multimodal therapies for children with motor disorders, and this is really a series of research projects around intervention effectiveness mostly, but also research into measurement tools that we often need when we do design research that aims to actually assess intervention effectiveness, and then knowledge translation research. So if we've got evidence that an intervention works, how do we actually make it happen in practice? How do we actually implement that in practice? So I just thought I'd give you one quick example here. So this is, we're currently running 2 multi-centre randomised controlled trials. We have collaborators in Western Australia, New South Wales and Victoria in this study. And we're really investigating whether or not we should continue to provide serially adjusted wrist splints for children with cerebral palsy. There's evidence in the literature that says don't do that, but in actual fact we have a lot of clinical experience that says I don't think we can stop. And so we need the definitive trial. So that's what we're trying to run. The IWAT trial is for young children, so they have to be less than 3 years of age to come into the study, and it's a 3-year study, so they stay in the trial for 3 years. And the minimising impairment trial is for children over the age of 5, and the same thing, they stay for 3 years. The little children, we are actually trying to prevent contracture in the wrist, and the older children we're trying to either maintain or improve. So that's the sort of goal. Within this study, we've actually spent quite a bit of time designing new devices, and which often happens when you run trials. So I just wanted to link the measurement issue into the intervention issue. So we've built a therapy app to actually collect data on routine use, aware of the splint, so part of the intervention, and to collect routine intervention information from children who are in the control group as well. The middle slide shows you the prototypes for some motion sensors that we've been working with the engineering team at Curtin University to actually measure range of movement, functional range of movement in quite small children. That's really complex and we're not quite there yet, so we're actually using the trial as a vehicle for the development of this device. And then the last one is an in-splint sensor, which will actually tell you whether or not the splint is touching the skin of the child, so it can actually be part of the kind of assessment of wearing time, if you like, but also can help you with fit, we hope, over time. So just a sort of flavour of those things. So the third one was, the third theme was looking at mechanisms of motor control, learning and cognition, and this is Peter Wilson's leadership in this space. And I wanted to give you an example of Karen Kayenberg's work, and she's a postdoc with us at ACU. And so this is really sort of basic experimental work with children with and without impairments, and really looking at some of the neurophysiological markers of cognition, changing cognition with recovery after injury, as well as in response to rehabilitation. And so I'm going to show you, this is Karen's slide. Just put it up there. This is Karen's slide, not Christine's slide. So this is Karen's model, and really I wanted to highlight for you that, that Karen's work is very much based in building neural network programs to understand what's happening in the brain in response to an injury and in a response to recovery and in a response to interventions that might promote recovery. And so really she's trying to build the links between motor and cognitive control, patterns of brain stimulation and what happens with grey and white brain matter. And particularly wanted to focus on the fact that most of her work is actually working in this neural networks space. So rather than looking at just one form of measurement of brain activation, trying to build more. So of course some of her research is with people with and without impairments, but also the effect of training and experience, as I've indicated. She's the person to ask. Please don't ask me any questions about this slide at the end. Okay. The fourth theme, innovations in rehabilitation using new technologies. Again, this is some work that's being led by Peter Wilson and really using what he describes as virtual reality tools in rehabilitation. And the two different tools are called Resonance and Elements, and I'm going to show you just a few little images of some of his work. And so Elements is designed as both of them are designed as this tabletop interactive device. And the Elements device you can actually program for motor and cognitive training, and it provides the individual who's actually engaged in that training process with really good quick feedback on what they've been doing, and extends performance, both cognitive and motor performance, by that. Now the other device, which is called Resonance, Resonance is a very similar tablet, as it's quite a big kind of piece like this, but it's actually a creative arts piece, and it's been designed as an art-science collaboration with RMIT and Peter, and they actually is really what I would consider a participation intervention, as in you actually go in and work together in a workshop to build a creative piece, whether it's an artwork or a music piece. And so it's a composition tool, and so individuals work together to create a composition and then to have a performance. So they display either it as an artwork or a music piece, or both, and that workshop situation builds the skill set. So we're actually looking at this as a participation-based intervention that will change activity, competence, sense of self and preferences as outcomes. Okay, so you're actually looking at providing the intervention in the other direction, if you like. A really nice example of using really sophisticated technology to build something that provides individuals with very direct feedback about their own performances, and within the context of a workshop where they are given guidance around design and composition, and work together collaboratively with each other, that young adults with intellectual impairments have really benefited from this as an outcome. So that's exciting fun. And then the fifth area is the parent and family factors in childhood disability, and I've already alluded to this as being really important, and we're using a variety of different intervention approaches and looking at this in a variety of different ways to try and assist families and parents particularly to have good wellbeing outcomes themselves. Mothers in particular are very much overrepresented in terms of having a physical and or a mental health issue as a consequence of having a child with a disability. That needs to change. That's actually not okay. The example I'd like to share with you is WOW, which is called Welcome Orientation Workshops, which is just in its design phase. We're just in the development and pilot testing phase of this. So Laura Miller and Peter Rosenbaum are actually building a package of workshops that will be provided to parents where their child has received a new diagnosis. And it really is around building on what we know today about I guess bringing families into that experience and helping them perhaps not to be so focused on the negativity aspects of that diagnosis, but to look for the opportunities for health and growth and development, and to actually learn some of the things around navigating service systems, about what does it mean to be a part of a family-centred service, and how do you manage the contextual factors within your family as well as within your community to have a really good outcome for the whole family. So that's exciting work at the moment. Okay, just in the last few minutes, I just wanted to talk about the structure. I've mentioned Peter and I as the co-directors, but we also have a senior research fellows who are professors of different international collaboratives that we're working with, and ACU researchers who are part of that. So our senior professorial group has been really critical to the development of this collaboration. The other thing, and I'm going to talk about each of those people a little bit more, but I did actually just think I would flash this slide up. We have a lot of HDR students, I think, for our relatively small group of people and relatively new to it. The four at the bottom in blue are 2016 HDR graduates, so that's exciting. But the rest of them are actually currently HDR students doing projects in amongst those different activities that I've already described for you. So, and you can see that it's interdisciplinary from the background of the individuals there, and we're really open to students of any discipline coming into any of those programs of research. We also have I started writing the list of external collaborators, and then I just stopped because I just thought this is really silly. But just to give you a bit of an idea across Australia, that we have strong collaborations in, we don't have strong collaborations in the Northern Territory, but we have strong collaborations in the other states of Australia. and in terms of our work. And the other really important thing is that we explicitly set up CEDA with a strong community collaboration focus. So Vicky Cavaliros, who is the CEO of the Cerebral Palsy Support Network, is one of the members of CEDA, and also Frances Hunter, who is the mother of a young adult with cerebral palsy, and Catherine Gaskin, who is a very good researcher in his own right, but also has cerebral palsy, are also core elements to the design of what we do. And so they're part of our planning for future research, and we embed involvement of consumers, whether they be young people with impairments themselves or family members, into the work that we do across each of the projects. The international collaborators are very important to us. So Professor Peter Rosenbaum is one of the founding directors of CanChild in McMaster University in Canada. And Peter is a developmental paediatrician, and he also is a professorial fellow at ACU, so has a part-time appointment with us. And so what that does for us is it means that we actually have collaborations and links with research projects happening in Canada as well as in Australia. So we have really easy to have exchanges. We do lots of Skype and Skype conference calls either early in the morning or late at night. So we're actually part of the research teams that are occurring there. The ones that I'm involved in at the most, or that we are involved in at the most, are actually with young adults and designing research in collaboration with young adults who have cerebral palsy or another impairment around what is the research agenda for young adults who have a disability. Bert Steenbergen comes from the Netherlands and from the Radboud University Behavioural Sciences Institute. He has a movement science background, and a lot of his research originates in that motor control cognitive changes for young people who've got an impairment. And he's done a body of work in cerebral palsy and a body of work in developmental coordination disorder, but also does a lot of work in engaging with young people in participation outcomes as a result of the interventions that they offer. We have a relatively continuous stream of exchange students, undergraduate students as well as graduate students, who come to us and they get their hands dirty in a research project. We give them a really specific task, and at the end of it we get a publication sorted. So we actually get some work along the way, and the student gets a really good research experience inside of our research group. Mats Granlund comes from Sweden, from Jönköping, and he's one of the directors of the Child Research Group, which is Child Health Intervention, Learning and Development. I think they've got the most clever acronym for anybody. They've done well. But I've been collaborating with Mats for a long time, and their focus is on education, psychology and health together. They only do research in the child space rather than into adulthood, but they've got a really strong research group, and we've worked very much with them around some of our participation-based research activities. And we have collaborations with a number of different projects, particularly international collaborations. We've got a new participation measure that we've designed as a part of a UNICEF project. We're now trying to collect data in low and middle income countries around that particular measure. And then Andy Gordon, who comes from New York, and he runs the Centre for Cerebral Palsy Research in New York, and has been really focused on models of intensive training and outcomes for particularly kids with CP, and does very nice models around randomly allocating to different interventions. So, for example, if you're looking at an intensive training paradigm, children might be randomly allocated to get an intensive speech and language intervention, or an intensive upper limb intervention. And so you actually have the children coming in for their 3 weeks block of therapy, and they will be randomly allocated to one or the other of those. And of course there are always complications with those things. But they run a very interesting program and a very well-respected program of research. And so we're again linking into, they're collecting some data for one of our projects in their intervention study. So we can actually use that data to solve one of our other problems. Nearly there. Measuring impact. This is important for most people in universities, presumably in health services as well. How do we know that it's working? How do we know that it's worth still trying to do this as a centre? And really the bottom line is, are we publishing? And it's not how much are we publishing, but actually are we publishing in a way that people take notice of? So do people want to read what we're doing? Do people want to cite us because it actually helps them build their next thing that they're doing? So how do we get that sort of out there in a way that's really effective? Can we get the grants? Do we get the money in? And how are we building those relationships and really maximising our opportunities on the basis of those relationships and getting those HDR students there coming through? So I think we have a lot of research enablers. I think we have an opportunity, And I'm hoping that I've said enough to whet your appetite that there could be an opportunity for you. Again, I would say we have an open door, so conversations are really worth having. We do have, I think, a clear vision for what we want, but we're not narrow. So I think we actually have a way of thinking broadly. So I think that can be a good invitation perhaps then. I would like to just do a bit of self-promotion here. We are running a research symposium in March next year, to which you are all invited. We have just sent out a call for abstracts. It is really focused on the motives, methods and measures related to participation. So when we say motives, we're really looking at how do we intervene to change participation outcomes, or indeed how do we use participation as an intervention to change other outcomes, and what are the measures and methods that are important to that. So I think that's probably it from me.